Dental problems in the mouth, especially the thing called TMJ, the very thing I cannot pronounce in its full name. Anyway, a misalignment of the mouth, you call it a bad bite, causes sometimes severe headache, shoulder pain, neck pain. And you guys adjust that. Number one, tell me a little bit how you adjust that. Is it a really major type of procedure? Is it like something, tell us a little bit how. And also, I have heard that there is a tremendous amount of dentists who, once they adjust the mouth, they actually also send the person to a chiropractor because the misalignment of the mouth might have put tension on the whole body, and a chiropractor is needed to do the rest. Sometimes chiropractors align the body, but say you've also got to, fix this here with a dentist. In fact, even I've heard from dentists who, with a chiropractor, also involve a podiatrist, simply because some people burn the candle on both ends. Their body is misaligned on the feet, and maybe it started in the head, maybe it started in the feet, maybe it started because of a little accident by lifting bad in the back. Either way, it seems to be a trio of people who quite often are needed to fix major headache in a person, even as bad as migraine, and completely cure get rid of the DMJ problem, even though the DMJ problem gets read by the dentist. But if the other things are too out of alignment, it keeps putting out of wacko again. Tell us about it, of what I said, how right on am I there, or how far off am I there, and what is your viewpoint on it? How do you go about it?
Okay. TMJ problems can come in different forms, and as they we look at it and we evaluate it and decide which is best of a range of treatments that are available. It may be something as simple as just adjusting the bite. Maybe there's a tooth that's been out of alignment and it's causing the jaw to be out of alignment. It may be that the person is clenching or grinding their teeth, setting up some muscle tension and misalignment of the jaw. In that case, sometimes we can make what's called a bite guard or a night guard, and that can help to alleviate that kind of situation. Sometimes in a more severe situation, which is rare, occasionally the person may even need some jaw surgery, or if it's not so severe, sometimes orthodontists can be helpful to realign the teeth and alleviate the problem.
Got it. And what about the potential need and supplement of a chiropractor and a podiatrist to make sure that things then stay aligned and that other body parts don't pull the jaw back out of alignments? What about that part?
Right. Sometimes some of these other physical therapy and chiropractic type treatments are used as part of a total plan to help relieve the person of the muscle tension, aches, and stresses on the joints. Yes.
And do you agree that, you said chiropractor and physical therapist, do you agree that sometimes the podiatrist has its part there because the person doesn't realize that, he has a longer foot or a shorter one, same thing, I guess, or, walks otherwise crooked, maybe even as much as as little as a bunion, and by doing so he walks funny and crooked and gets everything else continuously out of alignment. Is there some value to that also? And have sometimes the chiropractor you send patients to when he has a TMJ problem, has it happened that they referred the patient to a podiatrist as well, and then you worked it together?
it's possible. It doesn't happen that often, but the whole body has an alignment, and it does all work together. It's one system, and if one part is really out of alignment, out of whack, you could say, it does affect the rest.
Okay. Well, all right. Good. So, and have you seen, in terms of like getting rid of headaches, back pain, lower back pain, shoulder, neck pain, that doing DMJ work, aligning it, whether it's just by the dentist with the mouth guards or with the orthodontic work or with the fixing a tooth, or if it is whether it is in coordination with a podiatrist and or a chiropractor, physical therapist, have you seen some actual real major improvement in terms of headaches and stuff where people before that just couldn't get it?
Yes, absolutely. Yeah, the people who, let's say, they get an appliance and then we talk to them weeks, months later, they're using that appliance and they know that it's helping them, because if they stop using it, then the problem may reoccur. And so they go back to using it again, and they know the difference. It definitely helps.
Good. Wonderful. There are solutions, and sometimes, especially with headaches, lots of people have given up, and strong medicines and more aspirins and more Tylenol and more aspirins and more Tylenol seems to be the only answer. And again, when people have headaches, shoulder pain, their life seems to be becoming just difficult throughout the day. And yet it's again something as simple as like you're pulling or pushing on some nerves due to some misalignment somewhere in the body, which then of course the head is very sensitive, responses as like, hey, stop pulling me here, this is not good.
That's right. It creates stresses and strains. That's true.
Right. Well, thanks for your information here, Dr. Kreil. Bye-bye.